I am Dr. M. Unnikrishnan, a vascular surgeon working at SUT Hospital, Pattam in Trivandrum, Kerala State. I have been a founding member of our society. Today, I am going to tell you a little more about vascular surgery, endovascular surgery, and vascular diseases. As you all know, the blood pumped by the heart enters the cells and various systems in our body through a pipeline called blood vessels. Blood vessels carry pure blood called arteries, which will supply oxygen, glucose, metabolites, and other ingredients necessary for life. And the return of blood into the heart is through the veins. And so, when we call vascular diseases, it involves both the pure blood vessels called arteries as well as the impure blood which is being carried to the heart and lungs back for oxygenation. Now, the arterial diseases and venous diseases are the predominant causes of vascular problems, and particularly the arterial disease and the aortic disease is called lifestyle diseases. It was related to elderly patients, mostly 60, 65 years and above, and also related to what if I may call little indisciplined lifestyle, namely too much of food, too little of exertion and physical activity, and the other metabolic problems like diabetes, hypertension, and the use of tobacco and abuse of alcohol. Having said this, arterial diseases and aortic diseases can be also because of the age, 60, 65 years and above, and more involved in the male gender. So the major diseases which are arterial diseases are that which produces stroke, that is diminished blood circulation to the brain. To the heart also, the coronary disease is also a lifestyle disease. Then the blood flow to the legs, to the kidneys, intestines, etc. And then there is a cholesterol deposition or lipid deposition in smaller arterial branches of the what we call Mahadhamini, aorta. It produces diminished blood circulation. Whereas in the aorta, same atherosclerotic process involves in thinning of the wall, so that what we call is a ballooning of the aorta, that is called the aneurysm of the aorta, as well as smaller blood vessels, most predominantly in the aorta, and that can lead to a crack and a bursting, which can be life-threatening. Now, having said this, the venous diseases are a few of them, but predominant are varicose veins. Varicose veins happen because of our erect posture and because we stand on our two legs only, in contradistinction to animals which walk in four limbs. So there is a heavy gravity-related incompetence of the superficial veins and the valves. So there is a reflex coming in the prominent veins. That is there, and that we can easily remedy with an open operation, but awfully last 15-20 years we are using laser or RF ablation. Of late again, blue injection can cure the varicose veins. Then there is a potentially fatal problem of the veins, that is generally told as deep vein thrombosis, which causes in hospitalized patients when they are bedridden stage, when they are on ventilator, they have had a paralysis, they have had a fracture requiring plaster and immobilization. And then rarely, I will call totally rarely, not so commonly, because of the blood factors themselves, there are difficulties which makes the blood to clot in the veins more than in the arteries. After having said this, arterial and venous disease, there is one group called arteriovenous malformation, mostly congenital by birth. Then there can be venous type predominant, arterial type. They require techniques like embolization, and the surgical operation also for the 9 years. Now, what I would like to say, when there is a problem with the blood vessels, when an MBBS doctor or a physician identifies, I think the patient is best taken care by a vascular surgeon, because it's the science, art and technology which is there available with the vascular surgeon, so that patients will get their limbs saved, organs saved, life itself saved, and their quality of life improves. So may I request you that to have a disciplined life, that after 45 years you need not take heavy meals, you take minimum meals, you engage in some kind of activity, and we have even made a slogan that walk a mile to live with a smile. And the other problem which is highly common in vascular diseases and patients with vascular problems is the blockade of arteries to the legs, which can start as a simple problem of not able to walk half kilometer or quarter kilometer, but soon, if not attended, it will lead to more and more reduction in the blood supply to the legs. Then it can produce an ulceration, it can produce gangrene of the toe tips, then it can involve much more. So that is the situation. Instead of saying it is because of elderly, in various people call it Ayurvedic, homeopathy, but I think the best person to treat such situation is a vascular surgeon. We have options of control of risk factors, then medical management, endovascular management like keyhole surgery, and open surgery if it's a must, to improve and revascularize the limbs so that we can stand on our feet, we can walk on our feet. So may I again once more remind you, vascular problems are best dealt with vascular surgeons, and do not hesitate to come to the vascular surgeons for your quality of life and a longer life with all your organs, legs, kidneys and brain intact. So I wish you good luck and thank you very much for listening to me. Thank you.